Hello friends, Wink Martindale here for 1-800-MEDIGAP, America's trusted source for Medicare supplemental insurance. Did you know there are big differences in the premiums that insurance companies charge for exactly the same Medigap insurance coverage? Hello, Wink Martindale for 1-800-MEDIGAP. When you need help navigating the Medigap insurance market, call 1-800-MEDIGAP to connect with your personal insurance navigator. They'll guide you to the most cost-effective Medigap supplement plan for your unique situation. And best of all, their help is free. Yes, free. 1-800-MEDIGAP is A+ rated by the Better Business Bureau and endorsed by Esteemed Living. Connect today. It's free and easy to let our experts serve you. Call 1-800-MEDIGAP 24 hours a day, 7 days a week, or connect online at 1-800-MEDIGAP.com. 1-800-MEDIGAP also offers medical gap health insurance for individuals and families, making 1-800-MEDIGAP the smart call for all ages. Connect now. You'll be happy you made the decision to go with 1-800-MEDIGAP.
If you have a Medicare Advantage plan or are thinking about signing up for one, then you'll want to know about the 4 most common types of plans. And if you've had group health insurance from an employer before, then some of these should sound familiar. Let's start with the 2 most common: health maintenance organizations, HMOs, and preferred provider organizations, PPOs. An HMO might be for you if you are willing to limit your doctors, including your primary care provider, to those in a specific provider network, because except for emergencies, your plan might not cover out-of-network services. You'll also usually need to get a referral from that primary care provider if you need to see a specialist. A PPO might also have a provider network, but you can usually still get out-of-network care if you are okay with higher co-payments and co-insurance. With these plans, you don't have to choose a primary care provider, and you generally don't have to get referrals to see a specialist. You can see that these 2 plans are somewhat opposite sides of the coin, so you just have to decide what's most important for you. Another kind of Medicare Advantage plan you might want to know about is the Private Fee-for-Service Plan, or PFFS plan. These plans set their own rates for paying providers and setting your costs, like co-payments and co-insurance. Some PFFS plans have a provider network. These participating providers have agreed to plan terms and will treat you. You can also see doctors outside the network, but you'll have to check to make sure they accept the plan's terms and will treat you. Some PFFS plans don't have networks, which may give you greater flexibility. However, the doctor must be Medicare approved, agree to your plan's terms, and agree to treat you. You need to check before every visit. Another type of Medicare Advantage plan is a Special Needs Plan, or SNP. These are essentially tailor-made for certain kinds of health conditions, so not everyone will qualify. You might qualify for an SNP if you live in a nursing home or need nursing care at home, or if you have both Medicare and Medicaid. There are also certain health conditions that may qualify you. There are many, but here are just a few. In most cases, an SNP will require that you see doctors and specialists in the plan's provider network. Your plan will typically coordinate your care. Navigating through different Medicare Advantage plans can be complicated, but eHealth is there to help. To find out more, visit the website or call one of eHealth's licensed insurance agents today. Thanks for watching. If you're new to Medicare and interested in what coverage options might make the most sense for you, then you've come to the right place. As you may already know, Original Medicare includes both Medicare Part A and Part B. When it comes to hospital and doctor costs, it covers a lot, but not everything. In this video, we'll answer 2 important questions. How do I get prescription drug coverage, since Original Medicare doesn't cover most prescriptions I take at home? And how does Medicare supplement insurance work, and is it right for me? Let's start with learning how to get prescription drug coverage, also called Medicare Part D. It's available through private Medicare-approved insurance companies. There are 2 ways to get Part D. One is to sign up for a Medicare Advantage prescription drug plan. All Medicare Advantage plans are required to include your original Medicare benefits, and an MAPD plan also includes prescription drug coverage. Many plans offer additional benefits, and premiums can be as low as $0 per month with some plans. Just know that if you go this route, you might be limited to certain providers within the plan's network, and if you go out of network, you will most likely pay more for services. The second option is to stay with Original Medicare and sign up for a standalone Medicare Part D prescription drug plan, or PDP, to work alongside your Part A and Part B coverage. Whichever route you go, here are some things you'll want to look into. Always review the plan's formulary. That's the list of specific prescription drugs that are covered, so you'll want to make sure your medications are on there. Keep an eye out for your annual notice of change every fall. This will tell you about cost or formulary changes for the coming year. Costs vary, even among plans with similar formularies. If you don't like what you see or your needs have changed, you can switch plans during the Medicare annual election period. In fact, an eHealth study of people with Medicare prescription drug plans found that on average, they could save $782 a year by switching to a plan with better coverage for their needs. To be eligible for a Medicare Advantage plan, you have to be enrolled in Medicare Part A and Part B. For a standalone PDP, you have to be enrolled in Part A and/or Part B. For either type of plan, you also need to live in the plan's service area. You can sign up when you first enroll in Medicare during your 7-month initial enrollment period. If you don't, then you can sign up or switch plans during the Medicare annual election period from October 15th to December 7th each year. There are other opportunities to enroll during certain situations. These are called special election periods. For example, you may qualify if you lose your coverage when you move or if your employment-based coverage is ending. And one final note, you may want to sign up for a prescription drug plan when you first enroll in Medicare. If you don't, Medicare might charge you a late enrollment penalty, which will compound the longer you are not enrolled. And if you need a prescription before your next enrollment period, you may have to pay high or full prescription prices. Now let's talk about Medicare supplement insurance, also referred to as Medigap. These plans work alongside your original Medicare coverage. They can help cover the gap and pay your Medicare Part A and Part B out-of-pocket costs like co-payments, co-insurance, and, depending on the plan, deductibles and emergency medical care when traveling overseas. While costs can vary, the basic plan benefits are standardized in most states among plans with the same lettered names. For example, Plan G in Oregon will include the same basic benefits as Plan G in Florida. Here's a list of just some of the standard plans and benefits. Plan G is one of the most comprehensive. It covers almost all the standard basic benefits at 100%. Some states offer a high deductible version of Plan G that typically has a lower premium, which might appeal to you. Plan N is very similar to Plan G with a little less coverage. And an interesting feature of Plans K and L is that they have annual out-of-pocket limits. If it's important to protect yourself from unlimited spending on Medicare costs, then look into these options. Make sure to check out a complete list on the eHealth website so you can weigh the pros and cons as you shop around. One benefit of these plans is that they're portable, which means your benefits typically apply if you move to a different state. To qualify, you have to be enrolled in Medicare Part A and Part B, and your first opportunity to sign up is during what's called your Medigap open enrollment period. This 6-month window starts the first month that you're both 65 or older and enrolled in Medicare Part B. If this option appeals to you, it's generally smart to sign up during this time. Now, you can still apply after your Medigap OEP is over, but be aware that you won't have that guaranteed acceptance, and you might be charged more. So now you know a couple options for boosting your original Medicare coverage with either Part D prescription drug coverage or Medigap insurance, or both. Here's a simple chart to summarize what we've covered. This might even be a good place to pause the video and take a closer look at your choices. As a licensed insurance agency, eHealth is there to help you decide the plan and coverage that's right for you. If you are comparing plans and shopping around, there are some easy-to-use tools on their website, as well as lots of great articles and more informational videos like this one. And sometimes it's easier to just pick up the phone. So if you have questions, call eHealth today. I sure hope this has been helpful, and thanks for watching. If you're coming up on 65, you may have heard your friends talk about Medicare options, different benefits and plans, what works and what doesn't. And maybe you're thinking, I thought Medicare was Medicare. Well, you've come to the right place. In this brief video, we'll talk through your options and why people choose different plans, and then you can decide what's best for you. Let's start at the beginning. There are basically two parts that make up Original Medicare, which is offered through the government. Part A is for hospital costs, and Part B is for doctor visits and other medical care. You can stay with this coverage or look into an alternative way to get these same benefits through private Medicare-approved insurance companies. It's called Medicare Advantage, also referred to as Medicare Part C. To qualify, you need to be enrolled in Medicare Part A and Part B, and you need to live in the plan's service area. So if a Medicare Advantage plan is just giving you the same benefits as Original Medicare, why choose that option? Smart question. That's where the Advantage part comes in. These plans can offer a range of extra benefits. Plans vary, but here are just a few that may be offered. Some plans also include routine dental, hearing, and vision care that are not covered with Original Medicare. You can even get one simple plan that includes prescription drug coverage. In fact, if prescription drug coverage is really important to you, you might want to go a step further and compare each plan's formulary. That's a list of specific medications that the plan covers. Prices vary too, so it really pays to compare, and you can easily do that on our website. Medicare Advantage plans might be sounding pretty good, right? But with all those benefits, aren't they expensive? You might be surprised. Many Medicare Advantage plans have premiums as low as $0 per month. Now, keep in mind that there are other costs. The government requires that you still pay your Medicare Part B premium. And while some plans do have $0 monthly premiums, some will charge a premium. With some plan types, your co-payments and co-insurance might be higher if you go outside the plan provider network. Costs vary among plans. Some Medicare Advantage plans have annual deductibles. After you pay your annual deductible, you pay co-insurance or a co-payment for covered services. To protect you from very high medical costs, every plan has an annual out-of-pocket maximum limit, and after you spend up to the maximum, the plan pays your covered medical expenses for the rest of that year. This maximum varies by plan. If you don't go with a Medicare Advantage plan, let's talk about your other options. If you stay with Original Medicare, you can then add on a standalone prescription drug plan, also called Medicare Part D. These plans are available from private, Medicare-approved insurance companies. It's important to note that if you're enrolled in a Medicare Advantage plan with a prescription drug plan included, and you sign up for a standalone Medicare prescription drug plan, you'll be dropped from the Medicare Advantage plan. You don't need both, and you generally can't have both. Your Medicare Part D may come with some costs, such as monthly premiums, annual deductibles, co-payments, and co-insurance. Something else worth mentioning is that your out-of-pocket limits will work a little differently under Part D. Medicare has built in what they call phases of your coverage. Once you meet your annual deductible, these phases have maximum limits to help contain your out-of-pocket costs. And lastly, here's one more option to consider. You can choose to stay with Original Medicare and supplement your coverage with what's aptly named a Medicare Supplement or Medigap insurance plan. These plans help pay for the gap between what Medicare covers and your out-of-pocket expenses. They can pay some or all of your Medicare co-pays, co-insurance, and more. Some plans cover your Medicare Part A deductible and even limited emergency medical care outside the country. It's important to note that you cannot have a Medicare Supplement plan and a Medicare Advantage plan at the same time. These plans are standardized with lettered names in most states. For example, the Medicare Supplement Plan G in Oregon will include the same basic benefits as Plan G in Florida. To qualify, you are required to be enrolled in Medicare Part A and Part B. A hallmark of this option is that you don't have to live in a specific service area, which makes this a good fit for those who travel. Your Medicare supplement plan will typically require you to pay a premium, but most plans don't charge co-payments or co-insurance. They also cover all of your Medicare Part A co-insurance for a year after your Part A benefits run out. And they usually cover at least part of your Medicare Part B co-insurance. Deductibles can really vary. Most plans don't have deductibles and even help pay your Medicare Part A deductible. However, there are high deductible plans in some states that often have low premiums. Plans K and L have out-of-pocket annual limits. If you reach the limit, the plan may pay your Medicare costs for the rest of the year. Your first opportunity to sign up for one of these plans is during your Medigap open enrollment period. You have to be enrolled in Medicare Part A and Part B, and this 6-month window starts the first month that you're both 65 or older and enrolled in Medicare Part B. If this option appeals to you, it's generally smart to sign up during this time. You can apply for a plan anytime, but after your Medigap OEP, you might be denied or charged more due to health conditions. So now that you have the basics when it comes to your options, how do you sign up? First, you'll need to make sure you're enrolled in Original Medicare Part A and Part B. If you are currently receiving Social Security, you may be automatically signed up. If not, you can sign up through Social Security in most cases if you visit ssa.gov. Here is a simple breakdown of the options we've discussed in this video. Some of them have specific enrollment periods, but you can generally sign up for any of them when you first qualify for Medicare. That's why it's smart to start deciding now what type you want. When you first qualify for Medicare, there's a 7-month initial enrollment period. This is a good time to sign up for coverage that's right for you. The annual election period happens every year from October 15th to December 7th. If you missed your Medicare initial enrollment period, this is the window when you can change your coverage. It's a great time to do some research to find the options and prices that best fit your needs. A great place to do that, shop, compare, and enroll, is on the eHealth website. You just enter your zip code and voila, it displays plans available in your area. You can even enter your prescriptions to see if they're covered, or find out if your doctor participates. Super easy. Well, I sure hope this has helped you on your Medicare journey. If you have questions, visit the eHealth website or call to speak to a licensed eHealth insurance agent. Thanks for watching.